This is my Unit 14 assessment. What, physiologically speaking, is diabetes? Diabetes occurs when there is a disbalance between the demand and production of the hormone insulin. It occurs when your blood sugar is too high, and this occurs because your body does not make enough insulin or does not make any at all. The deficiency is what causes this, and there's two types of diabetes, type 1 and type 2. What is the difference between the two types of diabetes? Type 1 diabetes does not produce insulin, so that is the reason that your blood sugar level is too high. And type 2 diabetes, they just do not respond to insulin well. Many of the symptoms of type 1 and type 2 diabetes are similar. They are present in many ways. Many people with type 2 diabetes won't have symptoms for many years, while if you have type 1 diabetes, you usually develop it earlier as a child, and you can develop symptoms typically over the course of several weeks. But the main difference is how the blood sugar levels rise. What role does genetics play in the two types of diabetes? In type 1 diabetes, you have less of a link to having it because of your genetics, because you need to inherit risk factors from both parents to have type 1 diabetes, and usually it's because of environmental triggers that you get it. It's usually related to cold weather, and it often develops more in winter than summer. And in type 2 diabetes, you have a stronger link to the family lineage, and although it does have that stronger link, it also depends on environmental factors. Studies of twins have shown that genetics play a very strong role in the development of type 2 diabetes, where in type 1 diabetes, sometimes one twin would develop and the other would not. What negative impact does diabetes have on the body? In type 1 diabetes, your symptoms can include increased thirst, frequent urination, bedwetting in children, extreme hunger, unintended weight loss, irritability and other mood changes, low energy, blurred vision, fatigue, and weakness. And in type 2 diabetes, your symptoms are as follows. You might have depression, you are overweight, and you have a lot of nerve damage in your hands and feet. Who's most at risk for the development of type 2 diabetes? If you're overweight or obese, age 45 or older, if you have a family history of diabetes, or have high blood pressure, have a low level of good cholesterol, or gave birth to a baby weighing 9 pounds or more, if you are not physically active, if you have a history of heart disease or stroke, if you have depression, or if you have polycystic ovary syndrome. Those are a lot of the symptoms that can lead you to having type 2 diabetes. So, because of some of those symptoms, it is important that you make good lifestyle choices to affect the onset and impact of diabetes. There was a study showed that each of the following behaviors was associated with a 31% lower risk for diabetes in men and 39% for women. These include not smoking, engaging in regular physical activity, consuming a healthy diet, using alcohol in moderation, and having optimal body weight. Of these lifestyle factors, obesity has the strongest association with diabetes. In addition, smoking worsens the body's effect to utilize insulin and affects the cells of the pancreas that make the insulin, so that would make your diabetes worse. And these are my sources, and that is the end.